first session, we have Dr. Sachin Ganorkar. He will be speaking on being an effective caregiver. Dr. Sachin is a physician and a public health professional with a lived experience as a family caregiver. His work primarily focuses on primary care, community based mental health, and building peer networks for families navigating chronic mental health conditions. Let's give a big round of applause for Dr. Sachin. For the event, we'll do a thing where until the speaker is here, we'll keep the round of applause going.
Thank you, Avantika. Thanks a lot. Thank you, Avantika. Thank you. Warm welcome to everybody. Thank you, Vijay sir. Thank you, Bipolar India. Is this fine? Yeah. Yeah. So thank you, Bipolar India. Thank you, MHSF, for the opportunity to speak. And I think I know Akila ma'am from in the she's in the crowd. So thank you, Vijay sir. Thank you, everybody, for your patience listening. So a very good morning. So my name is Sachin, and I'm a physician by profession. I've also done my public health and a PhD in public health from TIS. And I've been a caregiver for my mother who lives with schizophrenia for the last 55 years. So my encounter with schizophrenia has been roughly for 35 years. So this is what my experience I would like to share you with. So I think Vijay sir has very kindly asked me to open this innings, and I would just start with an example of cricket. So we have the IPL starting today. And based on my experience, I would just say that caregiving is like a test match. So if you see myself first as a son, and then I think studying medicine, and then looking at public health, and then I think looking at mental health as a condition to be managed. I think these are the stages I've passed from. And if you look at the game of cricket, if you have a game which is starting up, I think when you are a caregiver, I think you have to build an effective partnership. So there is a striker who's actually batting, who might be your loved one, and you would be on the non-striker side. So what you need to do actually from your end is to give support. So I think that is to build a partnership, and the person who's facing the ball is facing the reality. So you might have your loved one who's actually having a kind of distress. He might be having delusions, hallucinations, or if you see conditions in bipolar where you have mania or depression. But you have to be the constant partner who's at the other end, who gives his presence, his or her presence, to actually stabilize your partner. So in your life, your pitch might vary. So you might have a fast pitch, you might have a slow pitch, you might have a very fast bowler, which is that condition which is troubling your loved one. But I think on the end, you have to give the stabilizing presence. One thing I would just want to start with, maybe in the 90s when we were kids, and I could see my mother, her behavior changing, and her health condition also deteriorating. I think first what happens is you have a lot of anger and resentment. So if you see that change happening in somebody who's near you, I think you're just angry most of the times that why is this happening actually to you, and you are resentful, and you actually also have an emotional shutdown. So you might not define these emotions when you are a kid or when you are younger, but I think this is what you actually go through for a long period of time. The early 90s and mid 90s were not actually where today I think it's a great thing where you have something called Bipolar India where everybody's sitting together, we are having this discussion. That time you were just sitting alone, and there would nobody, you could not speak to anybody because families actually avoid you. So if you have somebody in your family who has a condition, usually you're just sitting alone. So that is my journey of caregiving. I would also not know the word caregiver then. So you are just actually some individual who's observing somebody in your family where something has actually gone wrong. And you are actually quite shy of it because you can't discuss it in the school, nor actually you can discuss it with your relatives because they just want to avoid you. So that's how the situation actually starts. And this condition actually continued when I was in medicine, because even in medicine actually hardly doctors study about mental health. So you might study anatomy, biochemistry, surgery, but psychiatry is an optional subject. So nobody actually looks at mental health, because mental health and community medicine, like public health, where we all of us are sitting and looking at support groups, which Bipolar India runs, is something which doesn't make you money. So you always focus on fields which actually immediately give you money. So I think till early 2000s, I was quite lost. And then my father was working in Hubli, Dharwad, which is Karnataka, and we met a doctor. who actually gave a new typical antipsychotic, which actually helped her, and she immediately got back to her functional. So my mother is also a PhD. She's a doctor herself. She's very well qualified. But we were staying in places like Indore and Aurangabad, which is Sambhajinagar, where we could not find actually mental health professionals. So that is a journey of confusion which a caregiver goes through. And I think today in 2026, we are lucky that you have awareness after COVID, and you have foundations which actually can shorten that journey. So I think that is what I would see as a caregiver is what not to do first. So that's what I would speak about first. That if you look out like a game like cricket, actually you need a stable partner at the other end. So that is what you as a caregiver can actually do. That you can be the stabilizing influence, and I think you should not try to do too much. So where does actually caregiving go wrong when you actually become too controlling? So actually, when you say that I don't want to fix this individual, so there's something gone wrong. The player at the other end might not be playing properly, or he might be like playing very rashly. He might not be seeing the ball which is coming from a fast bowler. I think you just have to calm him down and stabilize him, so that because he's actually playing the game. So you have to be that external person who tries to stabilize by your presence and not trying to do too much or give a lot of instructions or keep shouting. So most of the times earlier, I think we try to shout on the individual saying that why are you behaving like this? Why are you dressing like this? I think you're really weird. I also see Venkatesh ji in the corner, so I don't see. Hello, nice to meet you. So you try to fix the individual, and that's how you also get stressed out, and you also have an emotional overload saying that how can you manage this? Eventually, I think when you keep doing this, you face something called as a burnout. You get exhausted, saying कि मेरे घर पे ही ये सब ये क्यों हो रहा है और मेरे ऊपर ही सब कुछ क्यों है? Because you are actually there is nobody to help you because you are alone. Your families are not there around, and also financially there's nobody to help you. So I'll come back later to the aspect of finances of what families actually face. So actually you're totally alone. So in 2026, I think you have bipolar India and things which actually help you how to handle this. You have somebody on your back. But in early 90s and 2000, I think there was nobody. And your psychiatrist actually doesn't have time. So your psychiatrist is just there to give you medicines. And if you have 100 questions, I think there's just silence. So that's how I've actually, I worked in Rajawadi here in Ghatkopar, and I used to come with 100 questions. Ki yaar, mere ghar pe kya ho raha hai? And it used to be very difficult to speak because you always, as a medical student, you don't want to be judged. कि ये इसके माँ को कुछ प्रॉब्लम है और हम उसको जज करेंगे. So that is the thing. So even if you are a medical student, you're also judging yourself, and you across the community also people are judging yourself, and you don't know whether to speak. And the psychiatrists are not trained in the psychosocial model. There are good psychiatrists, no doubt, but there's nobody where you can vent out. So from the last 20 years in Pune, when I've been taking my mother, I think I've been sitting outside for maybe hours together to just fix her medicine. It's a transactional experience. The doctor is very, very good. He is very compassionate and has been very nice. But he has not come back and asked me, I think, what is going on with your life? कि तुम घर में क्या करते हो, कैसे हैंडल करते हो, दवाई कैसे देते हो, and why I'm saying all this because now in a lot of families whom I speak to, I think that is a struggle which has started for them. The families जहाँ पे identify हुआ है अभी भी बीमारी, तो वो स्टिग्मा में बहुत रहते हैं कि दवाई कैसे दी जाए, छुपा के दी जाए या हम कैसे उसको दवाई दें, and they don't want to take support from the people around. So what I would say first is I think take support. तो जो क्रिकेट में आप बोलते हैं कि आपका कोच है, I think you have to take support from people outside. I think that is where the kind of society we are built in, we feel vulnerable when we take support because we want to be invincible. We say that we are driven by ego saying that we should function like this, we should only behave like this, and this is how society should actually see us. So I think the first step is to take professional support. So normally, early in my time, when anybody used to go along, we had astrologers and we had people who were like well-meaning people, and the caregiving pathway becomes very difficult then because जब तक आप डॉक्टर के पास पहुंचते हो तब तक बहुत you are quite fed up and you are exhausted. So based on my 35-year journey, and even I think even before that, when I used to see people not treating my mother well, she was very well qualified and she was this thing. So I would see that difference in behavior. So that was stigma in the society, which is still there. It's not gone away; it is still there. And so once after you finish your education, when you get into your workplace you cannot discuss anything because your workplace is also judging you. Workplace looks at you with economic productivity कि तुम कितना contribute कर रहे हो in a hospital. Or I work with Apollo as a medical head, so they would see, okay, are you functioning from 9 to 5? Are you doing X, Y, Z? So there also there's nobody to help you. So that is where groups like Bipolar India, etc., can be of great support, where you actually can vent it out Uh, so that's where caregiving groups become a very important part. So the second stage of caregiving, what I was discussing with Vijay sir, is that first is that how do you develop a mindset? So if you're batting and if you're facing a fast ball, then I think you should leave few balls. हर ball को मारने की जरूरत नहीं है. मतलब, so if there's something which is irritating you, if you're looking after somebody and if you're the person who's looking after suddenly say something to you, I think you have to be non-reactive. You have to just leave that ball and let it go. You also have to sometimes draw your boundaries. तो आपको हर काम में उलझने की जरूरत नहीं है. जैसे क्रिकेट में बाउंड्री रहती है, आपको उसी तरह से आपका बाउंड्री बनाने की जरूरत है कि हर चीज में आपको रिएक्ट करेंगे तो आई थिंक यू विल ऑल्सो लूज योर एनर्जी. So I think first important part from the last 35 years is what I've learned is to be aware and be present, not to react every time. I think you should respond to the situation and not get over involved. Don't try to fix everything. I think the only thing which you can fix is your attitude. Maybe get professional help, get the medicine set up, get to self-help groups like Bipolar India, and also maybe I think talk to other people, indulge in advocacy, because अगर आप अंदर सब रखेंगे तो फिर आप that will also this thing. So today all of us have assembled. We are talking to each other. We are saying what is effective caregiving. Normally in a humane society, the burden should not fall on one person. तो अभी मेरे फैमिली में तो क्योंकि when I talk about this, सब लोग अलग अलग हो जाते हैं कि बोले ठीक है तुम्हारी मदर को है बीमारी तो हम क्या करें, तुम देखो क्या देखना है. So normally in a humane society, it should not fall on one person. Even if there's one more person, then your load gets down. But unfortunately, that condition has not come in our families. मतलब जो सबसे करीबी रिलेटिव रहता है वही एक्चुअली देखता है. या तो हमारी सिचुएशन में है कि दे अबैंडन पीपल. That's where you see that people are abandoned and because as a family you feel that you are quite overburdened, आपके पास कैपेसिटी नहीं है, या आप you're fearful कि मैं कैसे हैंडल करूँ ये सिचुएशन को. So that is where you join caregiving groups and you understand how to handle the people apart from getting medication. So that is the other part. Second part is I think what was told to me, psychoeducation. So जैसे आप क्रिकेट का गेम खेलते हैं, you know how the bowler is going to bowl, what kind of ball is going to come, how the pitch will behave, where are your boundaries. So you also need to understand the disease itself. So whether it's bipolar or it's depression or it's schizophrenia, I think if you understand the symptoms, then you don't react to the symptoms. बिकॉज जो बीमारी है और वो पर्सन है अलग अलग है. मतलब अगर मुझे डेल्यूजन हो रहा है, हेलुसिनेशन हो रहा है, और या मुझे द पर्सन इज अ मैनिक फेस, यू नो दैट इज अ सिम्टम. आई डोंट हैव टू रिएक्ट टू द सिम्टम. द पर्सन एंड द सिम्टम आर क्वाइट डिफरेंट, सो यू हैव टू लेट इट पास. If you start fighting with an aggressive behavior person, and you also get lost in the entire battle. So you have to leave that battle. I think that's the other thing you have to do when you do psychoeducate yourself. You have to educate yourself about medication, कि कौन सा medication उन्हें लेना है, कैसे अपने आप को stabilize करना है. Maybe get into the economics of medicines, where you can get medicines, because it's a long-term disease. It's a test match. So that's why I said today the IPL is starting. Caregiving is a test match, and 30 years before you started alone. Abhi now you have a lot of people around your MHSF. I have all of you people listening to me. Otherwise, before that, I think there would be nobody actually sitting and listening to all this. So you have that support where you can actually reach out and start talking about all this. Coming to 2010s and all, I think 2020 तक ये situation था where you go to a psychiatrist, sit outside, take medicines and come out. You have groups which you go. Time मिला तो क्योंकि I was in Hyderabad, so time मिला तो I could come to Pune and find that time. But now because of COVID, I think 1 million people face the same situation what we have faced for a long time. So अगर आप families हैं और आपके घर में कोई suffer कर रहा है, so you have suffered this for 30, 40 years, maybe 10 years, 20 years, wherever the disease started. I think COVID people suffered that for a year, where everybody was sitting in home and everybody was anxious. People were losing their jobs, people were dying, there was access to care. And I think that is where the mental health tipping point came. But while I think we have been facing the situation for years together, where we go to a doctor, our person is not behaving properly, then we again are trying to find a job for him. We ourselves are out of the job circuit because we have to give the time to our loved one. जो हमारा एम्प्लॉयर है उसको कुछ पता नहीं मेंटल हेल्थ का. दे हैव जीरो अंडरस्टैंडिंग ऑफ मेंटल हेल्थ बिकॉज एवरीथिंग इज एसोसिएटेड विद प्रोडक्टिविटी. कि भैया ये कितना मुझे पैसे कमा के दे रहा है तभी मैं इससे बात करूंगा, बाकी मुझे कुछ मतलब नहीं उससे. सो फॉरगेट अबाउट योर पर्सन हु इज विद मेंटल इलनेस. और तुम्हारा मेंटल हेल्थ भी तुम्हारा ठीक नहीं रहता है इन अ वर्क प्लेस. दैट्स द रियलिटी ऑफ द सिचुएशन. So I think after COVID, there has been a great change where people are ready to talk online, talk on Zoom, and I think self-help group formations have happened. So I think from 1990s in 2022, I've seen the tipping point where you have seen telemanas coming up and you have seen people talking to each other. And there has been an active upgrowth of mental health. But I would just say that I think a focus needs to be given more on severe mental disorders. जहाँ पे हम सब लोग बैठे हैं जो सबसे ज़्यादा लोगों को तकलीफ देती है पीपल आर जनरली टॉकिंग ऑन मेंटल हेल्थ आई थिंक दैट इज़ नॉट कि अच्छा खा लो पी लो सो जाओ एक्सरसाइज करो आई थिंक दैट्स फाइन which is positive mental health but we also have to look at people who suffer from chronic medical conditions so that is where actually we need support and that is where actually we need to focus when you do caregiving so as a caregiver how do I look after myself I think as in a game of cricket you take a drinks break uh, we have seen the movie Dhurandhar right now, which has come up, where I think Ranveer Singh is just like a presence behind. He's not interfering too much. जो चल रहा है वो चलने दो, but he's that presence. He only intervenes when it is necessary. So I think as a caregiver, you need to take your breaks. As you have a drinks break in cricket, you also have to rejuvenate yourself. You also have to step back if, in case you find itself too overwhelming. Uh, you can join something like a hobby class or whatever you like. And the other thing which you need to actually keep telling yourself is that uh, because I think the debate which I see in groups is it a burden? कि मेरे साथ ही क्यों हो रहा है मेरे फैमिली में ही क्यों है why do only I have to keep looking at all this why is not my family members coming up so I think you have to look at it as something as an effort you put in and not get too much attached to outcomes so outcomes definitely if you follow a process of giving medications of actually doing exercise and looking after ourselves and not blaming the person because the families whom I speak to are new people. I think a lot of blaming happens. Ki, my sister dresses very weirdly. My sister is actually spending excessively. She keeps the room very unclean. So actually वो बीमारी है मतलब वो आदमी जानबूझ के नहीं कर रहा है. So I think you have to step back from the blame. I think once you do that, then I think 50% of your battle is won. And then 50% then focuses on how do you look after yourself. I think you need to take your breaks. Uh, you need to actually exercise and look after your nutrition. And the most important part is looking after your finances because your finances actually get short because either you stop earning yourself or the person is not earning. And then you have to look at your property or whatever you have in your family to actually manage your financial affairs. So in that case, I think your finances, I think you need to look into. You need to speak to people around how you can actually manage your finances well. Because if you can manage your finances well, take medicines on time, go to therapy, whichever condition you are suffering from. Like you have your coaching in a cricket team, like you have Gary Kirsten who's coaching from outside, and so I think if you have a coach who actually tells you how to manage your finances, if you have a support team outside, then I think your entire thing is set up. So to be a caregiver, actually you have to build a team. Unfortunately, 30 years back, there was no team actually. You were, I think, doing everything yourself. You were trying to find out कि ये क्या चल रहा है. It's like the on the job training. Ki what is happening? How do I figure out whether do I tell the people or not? Uh, this is really weird that my relative is not dressing properly. She's abusive. There's a lack of hygiene. There's a little bit of hoarding going around. So how do you actually? Then you are actually stuck into that thing. So if you step back and take the person to medication, psycho-educate yourself. What is the condition? And don't react every time. I think because the less you react. So if you look at MS Dhoni when he's wicket keeping, I think he's not reacting every time. He's a calm presence behind, and he has to be actually alert every time. So if you look at hypervigilant, तो हमारे घर में कोई family member बीमार रहता है, especially mental illness, you're hypervigilant. कि वो क्या करेगा next time. So I think you have to first stabilize yourself. So that is what I would say. और कबीर का एक दोहा है कि बुरा देखन मैं चला बुरा दिखाना कोई मन देखन अपना मुझसे बुरा ना कोई. So I think first you have to start with yourself when you have to be a caregiver. And if you are lucky, like all of us here, you are here as a team. So if you can build that team, then I think you are super lucky. Then I think जो आपके ऊपर 100% caregiving का आप जो burden बोलते हैं, it's still a burden in a sense. We might put it as a we might use the word euphemism saying that it is love and affection, but sometimes it does overwhelm you क्योंकि हम वो बाहर continuously bear करते हैं. मतलब it is not for 1 year, 2 years. This goes on for 10, 20 years. So it does become a strain for some time, which might strain you. So there you have to start looking at external support. You can also take professional help for yourself in case you feel that it's actually troubling you a lot. You can go and actually talk to people and start doing some consultation or start looking after yourself. So that is the right way. I think first is what Vijay sir told me is first is how do you learn the right mindset? So I think over the last 35 years, I think you should start reacting less and responding more. That's what I would say. Second is psychoeducate. As and more you learn about the disease, the symptoms, what medication, I think the 50% reduction more happens. And the last part is if you look after yourself properly, I think then you're not irritated. Normally what happens is the family is irritable continuously. So अगर छोटा सा भी बात हुआ तो there's a flare up and people start fighting with each other. So I think if you also look at that, and I think out of 100%, 75% things is gone. And the last 25% I would say is that look at self-help groups or coming to conferences like this, where you can share. Can there be some caregiver respite homes जहाँ पे आपको time मिले recover होने के लिए? Or you speak about advocacy, or there are financial services or insurance or some support which actually reduces your financial strain. So I think then your 100% thing of caregiving is done. So I just wanted to thank you for this time and to open this entire thing. But my only thing is, I think to be less reactive and more responsive is what you can do in this situation today. When you have YouTube, when you have Twitter, when you have Facebook, and we have so much knowledge available. 20 years back, I think when I passed on in the early 2000s, there was nothing. There was no Google, so you had to actually read a lot and get your information. I think in 20 years, a lot has changed in that sense. So my mantra would be, I think, first what Vijay sir told to focus upon is the mindset change. I think less reactive. The second part, which I would say, psychoeducate yourself, and maybe your family members. I don't say that change happening because I have not seen because people just want to stay away. So maybe you psychoeducate yourself and draw your boundaries very properly. और जो आपके साथ है, I think उसको साथ में लेके चलो. अगर दूसरे लोग नहीं convince हो रहे तो छोड़ दो. Don't try to strain yourself. And the third part is looking after yourself is to actually speak to somebody if you're feeling too much strained. If your workplace or your family situations don't support you, I think you can leave that and build your new alliances. I think that could be a part of being an effective caregiver. I would say you should have a caregiver team क्योंकि अकेले से अगर आपका जर्नी 20-30 साल का है तो बहुत मुश्किल है संभालना. So I think you should have a caregiver team which actually can support you if you're lucky. And I think we have nurture which I saw you as a center. So आप जितना self help groups और उसमें जाएंगे उतना आपका confidence बढ़ेगा. So that's the psychosocial part apart from medication. Don't isolate yourself and say that अभी मुझे immediately फायदा नहीं हो रहा है तो मैं क्यों जाऊँ. It's a slow process. It's a very slow process. It takes time, but it will avoid your burnout over the next 10-20 years. So that is what actually I can say you, and that is how I'll finish my presentation. And thank you for your patience. Thank you.
Please, we would like to facilitate you as well. I particularly love the part where you drew parallels of caregiving with cricket, and I do believe that caregiving is way more than just going to the doctor's appointment or just like reading upon it, because caregiving is so intense and there is a thing called compassion fatigue that someone experiences. So it's so important to have a holistic care even as a caregiver. Thank you so much for your talk. Vijay sir, would you facilitate it?
May I invite Dr. Anjali to give a token of appreciation to Dr. Sachin for the amazing talk that he shared with all of us. Thank you so much. Yeah. And by the way, I need to share, the gifts being given away today are the work of our community. Touch Me Not, the author is with us here today. It's a journey living with serious OCD, severe OCD. Okay, Sakina is right here in the audience. Yeah. So again, a creative product of our community.
Can we have a big round of applause for him again? Thank you.